is being interpreted. Please choose your interpretation language.
Good morning, everybody. I'm Silvana Luciani and from the Pan American Health Organization, and welcome to this webinar, Cure All Americas, the implementation of the Global Initiative for Childhood Cancer in Latin America and the Caribbean. Before we get started, we just wanted to let you know that most of the presentations will be in Spanish as well as in Portuguese, and we have translation, and you just simply have to select your language on the interpretation button, which is at the bottom of the screen.
We have organized this webinar to commemorate the week of cancer survivals, and this celebrates the lives of children and youth in Latin America and the Caribbean who are diagnosed with cancer every year. Most of these cases are curable, and the survival rates are over 80% in countries that have strong systems of control. But in low and middle income countries, this rate is lower than 20%. And to face this inequality in health, WHO launched the global initiative to improve the survival from child cancer. And so we have this initiative, Cure All, to strengthen health services and to improve survival rates around the world. From PAHO, we have a very strong commitment, and together with our partners and the stakeholders, to implement the Cure All package and to improve the quality of care for children with cancer in order to diminish the inequalities in our region. So in this webinar, we will see the present overview and the situation of cancer in children and adolescents, and to underline the importance of collaboration that we have with the Child Research, Cancer Research Hospital, and also with Cancer International, which is an NGO that supports children and their families. In this webinar, we have different presentations by PAHO speakers and also other colleagues from different centers. And we welcome all of you, and thank you for being here today. Before beginning with the presentation, I would like to introduce Gabriela Alessandro Mallorca. He is known as Gabo. Gabo is from El Salvador, and he was a soccer fan in El Salvador. And when he was 8 years old, he was diagnosed with leukemia. And Gabo was referred and admitted to the National Program of Childhood Cancer in El Salvador. And then he was 5 years under surveillance. And now Gabo is 18 years of age, and he has graduated from the Garcia Flamenco School. And so he was asked to carry the national flag for the celebration of Independence Day. At present, PAHO is in Germany. He's studying German because he wants to follow his dream of studying medicine. And when I first met Gabo was when he participated in the world launching of this initiative in the United Nations General Assembly, and he shared his story of disease and treatment. It is an honor to have Gabo here with us within the Cure All initiative. Thank you so much. Distinguished guests, good afternoon. I am Gabriela Alessandro Mallorca. I come from El Salvador in Central America. I'm 19 years old. Thanks to the Pan American Health Organization and to World Health Organization for this invitation. For me, it is a privilege and an honor to participate in this seminar about the implementation of the global initiative of the PAHO and WHO in against childhood cancer in Latin America and the Caribbean. But once more, I would like to underline the National Program of Cancer from El Salvador in the childhood hospital. And through all of these programs, children with cancer in El Salvador have quality treatment. And then also, all the parents have the proper support when they don't have the financial resources. So this is dedicated to all the children with cancer, leukemia. And all of these words are very fearful. When we hear, we feel very fearful. We all have a life to live. And we have so many dreams. And then when we're children, we always think, and actually everybody really thinks that cancer is equal to death. So after having finished school, and I was in treatment at that time, I didn't want to finish there. Right now, I am in another country. I'm in Germany. I am learning German because I want to follow my dream. I want to follow a target that I have set for myself to be able to help people in general, but especially children with this disease. In 2014, when I was 12, I was diagnosed with acute lymphoblastic leukemia. And then cancer came, the cancer word came to my family and came to my friends. And then I knew that my dreams would be cut off right there. However, one of the things that really strengthened me was the fact that I saw many children diagnosed with cancer that were still living. And I was the new one, the new kid on the block. And now I understand that we all have to fight together against the disease. As many children that I met through my life and marked my life, I hope to do the same, because children like to play sports, children like to go to school, and much more. And for many children, like me at that time, we were afraid, we were in pain, we couldn't understand. It wasn't easy, but thank goodness, thanks to my family and to what they did, they searched for a treatment and I was able to forge ahead. And then the medical staff became my second family. And they are all in my heart. They actually marked my life as I went through that hospital. All of them fought with me. And they allowed me to fulfill my dreams. And they were a salvation to me. And I am glad I lived to tell you the story, because many others were not able to survive to tell the story. But I learned many lessons in my life. We have to keep on fighting. We have to have good treatment. We have to have a good medical team. And all of these members of the medical team were eager to give me their time. And I was able to finish high school without being backwards and behind in my studies. And I suffered 3 fractures during the entire process. But without the medical staff and their support, I wouldn't have been able to get there. So I want to improve the health in my country and the health around the world. And also, I want to make sure that we're aware of the needs of these patients. This, as time goes on, this gap between the ones who get treatment and the ones who don't is going to be larger. But I am here today, cancer-free. And for that reason, I want to be a voice for hope. I want to make sure that children have access to health, to high-level quality health. And then to make sure that all the dreams that these children have become true. We all deserve it. We all deserve to get to the goals that we have set for ourselves and to realize our dreams. Cancer continues to be a scourge for children, but I was blessed with life. And I want to make people aware of this. So for that reason, I call upon all the representatives, Ministries of Health, and all international organizations and all countries, collaborators at St. Jude's Hospital, oncologists, everybody who fights against cancer, get together just to make sure that all children, without any exceptions, can have the ability to keep on fighting and can have the opportunity that I had, to have the option to be cured, to have the option to reach your dreams and your goals. Thank you so much. I just want to make everybody aware, to make sure that we have to have dreams as children. Children are not only the future of the world, we are the present too. And we want to make sure that all of these children with cancer today can fulfill their dreams. Thank you so much. Thank you so much, Gabo, for these motivating words. Thank you so much for giving us the hope for cure. We know that childhood cancer diagnosis, it can be devastating for a family, for the patient, for society. But we know that some deaths that are caused by cancer are caused not only because of this disease itself, but also because of lack of treatment. And for that reason, the global initiative for the fight against childhood cancer was brought into the public agenda. And to be able to increase and strengthen the capabilities of the health services with the objective of having a survival rate of at least 70%. And so the technical package, Cure All, will help us implement this initiative to make sure that we have a stronger health system that we can offer to children and their families. And to be able to present this regional strategy, we have Dr. Liliana Vasquez. She is pediatric oncologist, and she collaborates with PAHO. She coordinates the Global Initiative for Childhood Cancer fight. And she has been working in Peru in the coordination of this initiative. Dr. Vasquez, you have the floor. Thank you so much, Silvana, for your presentation. And thank you so much, Gabo, for those heartfelt words. I believe that all of us here today value your efforts and the effort of so many health workers and all the collaborators who have helped us in this initiative. Thank you so much. Thank you very much for all the participants in this important event. It is a pleasure to be able to share with you this day and then to share the luncheon of Cure All in the Americas. And this is very important in the regional strategies for the implementation of this initiative and the fight against cancer. And we at PAHO are leading this effort in our region. It is important to mention that there are many inequities in our countries, that there are many differences. And anybody who has any questions for us today, we would be more than happy to answer. So how much could survival differ between one country and another? Those countries that have a stronger registries or better strategies to tackle this problem. We see this chart that reveals incidence and mortality by childhood cancer. We have an incidence that is similar in some countries, but mortality that is in red you see that the longer the bar, the higher possibility of dying from cancer, especially in children and adolescents. So this is the difference between one country and another. And also, it is important to mention that childhood cancer has to compete with many other diseases that have had strategies in place for many years in public health, such as hypertension, diabetes, and other types of cancer. So childhood cancer was not considered as a public health priority for many countries, despite the fact that we have a high level of morbidity. And also, we have a high incidence in children and adolescents. Also, there are many data, as you see here on this slide. We see the differences in 3 types of countries depending on the income. On the left, we have high-income countries, and we see the projection of the children that will never be cured because of relapse and because of progression of cancer. Also, we have on the right many causes, for instance, lack of diagnosis, misdiagnosis, no treatment, abandonment, etc. And so this could all be related to other problems that should change. For instance, abandonment of treatment, diagnosis, underdiagnosis that may exist in some countries. So among other causes that we can improve wherever we may be. So from PAHO, the childhood cancer program wants to tackle some specific programs to make sure that we diminish the impact of this disease in our children. We go to the priority problems: diagnosis, late diagnosis, lack of diagnosis, abandonment of treatment, malnutrition. Malnutrition is one of the things that is closely linked. Deficiency in oncological support, training deficiencies, and lack of services. And then we have also seen that we should not only stay in one point, but to have a focused strategy. For instance, detection programs, something that really gives us an impact by a combination of strategies. So we combine different strategies, and then we will be able to control cancer mortality much better. And then from that, we see the importance of mortality because due to childhood cancer. We had already considered this for many years at high level, first in the World Health Assembly, and then we finally decided that childhood cancer was a relevant program. And by the time September 2018 came, WHO announced the initiative for control of childhood cancer, the Cure All initiative, or the format that we want to give to this particular seminar today. Cure All Americas, is a strategy to be able to reach this goal. For 2030, we should have at least a 60% survival by childhood cancer at the world level, and to save an additional 1 million lives. And so we hope that this strategy could be local, national, or regional. The Cure All is based in different pillars. We see centers of excellence, universal coverage, different treatments, evaluation and monitoring, also advocacy through facilitators, and financing. So as a regional team, what do we want to accomplish and underline? Well, we are working very hard with all of you, not only those who are present here today, but many others, to to fight child and adolescent cancer in the region. We have 3 phases of this implementation. First is the implementation of the initiative itself in the region of the Americas. We work with the countries that have expressed a commitment. And I love this chart because we have all the flags of the countries. We have Peru, for instance, that has started this at the national level. It has, and then several other countries such as Panama, El Salvador, different countries of Central America, Costa Rica, Nicaragua, and also this year we have incorporated Paraguay, Ecuador, Brazil, Guatemala, El Salvador, etc. And we think this is essential because the work has been accompanied at the country level by us, and we have been able to go into 4 phases of action. First of all, we need to have a situational diagnosis in each country, and then we want to make sure that we have a national plan, an action plan, a strategic plan to be able to advance in the control of childhood cancer, then implementation and monitoring and evaluation. And then the second point is the development of regional dialogues and products, and we're working on that with all of you. And this is important for us because this is related to the problems that we have identified and that have been widely described in the world literature, such as timely diagnosis, palliative care, health services, abandonment of treatment, oncological support, psychosocial support, nursing services, registry, and nutrition. And for this, we have established committees, and many colleagues have entered their work in this proposal. There are more than 160 colleagues working right now on this, and they have been accompanying us in the first meeting to be able to get to concrete initial points. And then in this work, we have, on the one hand, to develop regional overviews for pediatric cancer, and then to be able to make decisions and also to have educational materials targeting the health professionals and give technical assistance in the development of regional projects. And finally, to have information material for the community in general so that the community knows about this. And the third important point is evaluation and monitoring of the initiative at the regional level. And this is a system that we will describe later on. But it is important to see what is the current state of our indicators of childhood cancer and how can we charter progress. So this is the information that I have for you. And you can all have access to this. It's available in our webpage. And we have summarized this with the team and also with all the collaborators. And we have had a lot of support from them with communication materials. And we have this as the implementation in Latin America and the Caribbean. We have this in Spanish and Portuguese. And also, as Silvana mentioned before, we had commemorated the month of the survivors of childhood cancer, and Gabo's words were very appropriate because we have seen at least one experience related to cancer, and we know that there are many opportunities to improve this, and for that reason, we have designed all of this information available in our webpage. You will have it in Spanish, English, and Portuguese, and this is all materials that you can disseminate through your colleagues to be able to give more opportunity to children suffering from cancer, as Gabo said, and our heartfelt thanks to our team, to our dear director Silvana Luciani, Clara Barajas, and then with all their experience in cancer projects, and also our care team, Karina Ribeiro, Soa Fuentes, and Liliana Vasquez, who are giving us the benefit of their experience and intense work in this fight. And then also to all our friends who have been accompanying us in these projects and dreams. It's St. Jude's Children's Research Hospital. And as Silvana said, this is one of our collaborating centers for childhood care, also for WHO. But there are many other centers that have been involved in and have been supporting us with projects and time and the work that is being developed. And finally, and most important, I would like to thank all the authorities and representatives of the Ministries of Health, the focal points of the WHO, PAHO offices at the local level that are implementing this strategy, to the experts from regional committees and local committees, to all the technical teams of PAHO headquarters and WHO headquarters, and who work here, scientific and academic societies in the different countries, and also multidisciplinary teams. And then they are the ones, the implementers of all of these changes at the global initiative. And then most important is the parents, organizations, and the patients themselves. I believe that they are the center of all of our work. Thank you so much and welcome. Excellent. Thank you so much, Dr. Vasquez. That was a very comprehensive and excellent presentation, and it shows the commitment that you have in Latin America and the Caribbean with the governments for the implementation of this plan. We started with Peru, and now we have 12 countries in the initiatives, and we have plans to expand this to the entire region, and we have the support of many other organizations, as you mentioned and shown in your slides. Now we go to the next presentation about the cancer and their implementation. And we have an analysis of the situation, and we have also touch on financing on this, and to talk about the design and implementation of pediatric cancer plans, we have our colleague in the team at PAHO, Dr. Suad Fuentes de Aparicio. She's a pediatric oncologist, and she's a consultant with us, and she has been focusing on the national plans, especially in the Caribbean and Latin American countries, Spanish-speaking countries. Dr. Fuentes.
Thank you very much. It is a pleasure to know that we are having all of these presentations and thank you for all of you for being here with us today. One of the processes that have been addressed within the health framework is to establish linkages within the country's health services to be able to work and also to control pediatric and adolescent cancer. And in Central America, the Dominican Republic, and the rest of Central America, we have been working on this. And as you know, the organization has these sustainable goals. The third one is well-being, and they have been defined by the World Health Organization that have the intent of promote or restore health. And the World Health Organization has created this framework with various synergies and communicators that will be facilitating the health policymakers, the design of interventions, and also to secure equitable access to health. I am not going to devote too much time to this, but we know that we have the goal for 2030, at least 60% has a gap between developed and developing countries. We have a gap And we are trying to reduce this gap and also to increase at least by 30% all that we are doing for these kids. And as it has already been mentioned, we continue to work in the area of pediatric cancer, so that this is later on part of a global framework for this initiative to address cancer in children. Something that we should bear in mind is that we know that in the countries, in the developing countries, the income is low to middle, lower middle, and there are different sources of funding for the care of pediatric cancer, and usually in these countries, health coverage is offered by the government throughout the territory and sometimes out of the pocket of the parent. And that's the reason why solutions have been analyzed to strengthen these health services that are providing this service to the population, to the child population. So the idea is to give priority to the treatment of cancer in adolescents and children with the support of local legislation. And this is key to develop the necessary capacity to guarantee continuing care of this population. With this goal in mind, different collaborators at the national, regional levels, in particular with this very significant collaboration with St. Jude and the global health system, PAHO has had different meetings with pediatric oncologists, representatives of health ministries, and administrators of the hospitals in Central America and Haiti, as well as in the rest of the countries in Latin America. How have we established links for the detection of cancer in childhood and adolescence to provide continuing care for cancer? In 2017, St. Jude, through the Global Medicine Department, started to work on the integration of health systems for the control of cancer among children and in the countries of the region. And they have strengthened initiatives such as AOCA in Panama in 2018, which was a workshop to start raising awareness among the authorities as to the need to create a national plan focused on the control of cancer. And goals were established, and on July 23rd, 24th, 2019, we organized the first regional, sub-regional workshop for the treatment of pediatric cancer in Costa Rica with the collaboration of key actors at the national and regional levels to integrate childhood cancer to the regional and national programs. So we have been working on these plans, and St. Jude's collaboration, PAHO, WHO, to facilitate the process for the development of national cancer plans with three main products: the development of a product within the 6 blocks of the construct for children and adolescent cancer, the development of an action plan that to be included as part of the national plan, and also an identification of the national priorities. And this is how we have been working on the various 6 blocks within the health services: leadership, governance, human resources, access and use of services and information services in health, and also reference systems, medicine access. And they have focused on the 6 indices such as leukemia, Burkitt lymphoma, Hodgkin disease, and among others. And as we have developed the national plan, we have also included some processes for that included, as I mentioned before, cancer in childhood and adolescence. And this is something that the Secretariat of Health did. Also, the situational analysis of cancer in childhood and adolescence in each country, and also the development of a strategy for the treatment of cancer and a plan of action. In each of these stages, we have seen a process that included the appointment of an advisor at the ministry level, an advisor at the level of PAHO, and also the appointment of a multi-sectorial working group with the participation of the various bodies that are handling pediatric cancer at national and regional level. As part of the proposals, the analysis of cancer in childhood and adolescence has led to a solution analysis that includes the feasibility analysis and the definition of the strategies. With a proposed strategy for treatment of cancer in childhood, a plan was developed that has to be assessed, and we need to prioritize the alternatives and actions to be implemented, as well as to select indicators and goals. So once the plan was formulated, we have established a commission that included the ministerial advisors in areas of cancer, the validation of the policy by ministerial authorities. And I should also mention here that after the validation by the advisory commission, the indicators and goals are reassessed to move on to the reformulation by the authorities to finally have a document that is a national cancer document. At the same time, these activities also included the identification of regional aspects. And here we have COMISCA as a policy body that makes decisions within the area of health. And this also has provided technical assistance and initiatives at the regional level, and it has identified various initiatives that can be implemented in the various countries for regional support to the task carried out by the state. And this is the way after the Costa Rica workshop was held on In December 2019, there was a meeting with the various pediatric authorities in Central America, and the idea was to meet the WHO goals to raise to 60% survival rate among the pediatric population, and also attain a political commitment to implement standards and tools for planning and application of the interventions in connection with the comprehensive care of pediatric cancer, and also to improve access to medication and technologies for comprehensive care of pediatric cancer. Slowly, each of the countries in the region has been participating in this process, led by Peru, as we saw at the outset, and Panama is a leader, a spearhead, as they said it once. They spearheaded the global initiative or the implementation of the national plan for pediatric cancer in Central America, Panama, but also working with the global strategy. El Salvador followed. They are also in the implementation process, and Haiti validated yesterday their national plan. But not everything has been easy, and we have seen challenges in the implementation of these pediatric cancer plans. And as part of the challenges, the main ones that they have identified is to facilitate the mobilization of financial resources, the improvement of capability and creation of enabling environment, the COVID-19 pandemic halted the activities being implemented, but at the same time, progress has been made, but also another challenge was to guarantee sustainability of interventions during the current health situation of COVID-19. It is important that we have been working with the support of the Pan American Health Organization and the St. Jude Global Medicine Department to facilitate the inclusion of the groups that are working on purchasing medicines and also financial and technical resources for prioritized interventions, keep training on pediatric cancer, continuity of technical support, documents, material to learn, and also to continue with the work underway. Many of the countries have indicated that experience shows the importance of the intersectoral significance in the treatment of this problem, and also we need to work with the information systems such as cancer registry, the integration of the various sectors that may contribute to create technical, solid, successful proposals with future sustainability. And we have also learned to use a participatory methodology with all of the sectors and actors from the public level cooperating on the initiative, and also the experience of having the holistic support of the Ministries of Health. And I think that St. Jude's Children's Hospital in PAHO have had a key role to create the link among the Ministries of Health to support the various sectors working in the area of pediatric cancer. And I shouldn't devote too much time to this slide, but at the end of the day, and as to the progress made in the implementation of the national plans, progress has been made in the implementation of the global initiative for childhood and adolescence. And this is the way in which various countries have participated in the various phases: situational diagnostics, followed by Panama, El Salvador. And then we have Costa Rica, Guatemala, Honduras, Haiti, the Dominican Republic. Many are still in the planning stage. Others are in the implementation stage, such as Peru, Panama, and El Salvador. And Peru, that is already in the later stage. To sum up, this is the work carried out so far. As Silvana mentioned at the outset, part of the machinery to improve access to the health services of children affected by cancer in the region, and also to reduce the gap in survival that we see between developed and developing countries. There are many collaborators, and I do not want to forget any, but I would like to mainly thank the St. Jude's Hospital and also the Department of Global Medicine, since they have provided unconditional support and they have been one of the main collaborators with PAHO and WHO on this mission. I would like to thank you all. And we should work so that we don't leave anyone behind. The same way Gabo was able to have access to this, everyone should have access to this. Thank you very much, Dr. Fuentes. And in spite of all of the challenges, such as the pandemic with problems, financing costs problems, it is really motivating to see so many countries that have developed their plans for pediatric cancer with the support of PAHO, St. Jude, and all of the partners behind this initiative. The initiative has a very ambitious goal to improve survival and access to services, and it is very important then to have the metrics to monitor and assess the progress so that we can attain the ideal goals we have for 2030. So the next presenter will be addressing monitoring and also key indicators to measure this initiative in the region. Karina Ribeiro is an epidemiologist with a long trajectory in the area of cancer and pediatric cancer, and she is now part of our team as a consultant. She works with PAHO here in the pediatric cancer team, focusing on monitoring and data. Dr. Ribeiro, you have the floor. Good morning to all of you. Thank you very much, Silvana.
Thank you, Silvana, for your very kind words and for this opportunity to develop this joint activity. It has been a great pleasure to be a part of this team and to have already reached some of our goals and to aspire always for many more. And I am always moved whenever I hear about the subject and whenever I hear Gabo talk. And many years ago, they asked me, why did you choose to work in this field of pediatric cancer? Because as an epidemiologist in cancer, I could focus on so many other types. And I answered that it was because I liked it. I enjoy it. And I'm very passionate about it. And I feel like whenever we do something with great love, we have a greater possibility of being successful. So today I'm going to be talking to you about monitoring and evaluation of the WHO Global Initiative for Childhood Cancer in the region of the Americas. After these wonderful presentations before me, you were able to understand the essence of that initiative and what our goals are. So now it's time to look at some figures. How can we assess whether we have been successful with this initiative? So we work with populational measures. We hope to reach all children. And generally speaking, not only in dealing with childhood cancer, but all types of cancer. We can assess progress in cancer by measuring incidence rates, survival rates, and mortality rates. In other words, we want to know if new cases are increasing, decreasing, if cancer patients are surviving more often or less often, and if those patients are dying more or less. And when we decide to assess incidence rates, when we monitor whether these new cases are going up or down, there are some challenges in using those rates as a way to monitor cancer, because they end up reflecting events that happen before diagnosis. And unfortunately, in childhood cancer, we know very little about what causes it. So we have some very few cases in which we can pinpoint the cause, but in most cases we don't, such as the relationship we can establish for adults between tobacco use and lung cancer. So it's very difficult to monitor and define primary prevention strategies to prevent those cases to happen in childhood. In the adult world, incidence rates may reflect risk factors, tracking or screening practices, but something that's very relevant for childhood cancer is that any changes in incidence rates may be impacted by changes in diagnostic practices. So for instance, when the use of computerized tomographies and MRI later started to be used, the number of diagnoses of brain tumors in children became more frequent, which were not the case prior to that. And the other challenge is that classifications are changed constantly. Science advances, and there are some neoplasms that go from borderline to malignant, or they're reclassified from malignant to borderline. And as Dr. Suad mentioned, we have populational basis data, but we also need quality data. And any changes in the level of quality of that data can artificially change the number of new cases, either by leading to an increase or decrease in total number. And we also have survival, which was set as the main goal to reach at least 60% survival rates for all children worldwide. And in childhood cancer, we found some discrepancies in how survival is defined. Some people call it all-cause survival, which in Portuguese we call it global survival. It could be patients who are alive 5 years after the diagnosis. We often use that reference number of 5 years. But when we talk about all-cause survival or overall survival, we include any cause of death, not only death by cancer. But when we calculate what we call specific survival, cause-specific survival, in which we would only include patients who died due to cancer, but then we bump up against information systems and also how to determine why death occurred. And something that has been greatly used in cancer populations is what we call relative survival, which is the percentage of individuals with cancer who are alive 5 years after their diagnosis compared to the percentage of the overall population of same age, sex, race, ethnic group living in the same 5-year period, in which case I don't need to refer or I don't depend on the specific cause of death. I simply compare that same cohort, their survival with the overall population survival. So relative survival is the recommended method for comparing survival rates between different population-based cancer registries in different countries, since the cause of death may not always be available, or there could be some great variability in the accuracy of cause of death in different countries. As I told you, our objective within the global initiative is to reach at least 60% survival rate for all children with cancer worldwide. This data derives from the Concord Study, which is a very large study. Up to a few years ago, cancer registries were very concerned with collecting incidence data. They did not collect information on how those patients were followed up on and survival information up until Eurocare started a movement in Europe, and later a worldwide study took place, which is the Concord Study. It's now in its 3rd edition. They're gearing up for their 4th edition. And you can see on this table how you have data for the main childhood tumors, brain tumors, acute lymphomatic tumors, and lymphoma for 2010 to 2014, and that's the 5-year relative survival. And unfortunately, most results in most Latin American countries and Caribbean countries, they are far below, as Silvana made very clear early on in this webinar. The figures are far below US and Canada. In the United States, we have 90% for ALL, while we have rates around 60%, 50% in most countries. You may be surprised that only a few countries and a few registries are on the table, but that has to do with a lack of coverage in the population-based cancer registries in the region. And even when we receive the data, we need to assess the data quality so that there's enough quality to allow them to be published. And when we assess, another indicator which is very often used for assessing progress in childhood cancer, we look at time trends in mortality. And it is possible that those trends are real changes, that there is a decrease in survival or decrease in death rates if mortality changes due to changes in survival, or also it could be due to incidence. If fewer people become sick, fewer people will die due to that disease. But there are changes that are not real. They are artifactual. So there could be an improvement, for instance, in the quality of death certificates. There could be a change in mortality trends because of that, or also when there is any kind of changes in the disease classification. It could lead to a change that's not actually real. So it's important to remember that this will be a later reflection of progress in cancer control. It takes a few years before we can actually assess whether the initiatives were successful or not. This image shows you, this graph plots time trends in mortality in the United States from 1975 to 2018. This graph is very often used, and we like to see it because while incidence is increasing, that is a transition that happened in many advanced countries that keep close track of infectious diseases and other causes. We see an increase in the incidence rate in cancer. However, the mortality rate is dropping. I placed both curves in the same graph, and you can see that there is a drop in mortality rate over a 40-year period. Unfortunately, that is not the case in many countries. There is great inequality and differences between countries within the same country, regional differences. This is mortality data in Brazilian regions from 1980 to 2019. And you can see quite clearly that we had a decrease, a considerable drop in the southern and the southeastern regions of Brazil, as well as in the Midwest. Not to the same extent. Those are the most developed regions in Brazil, the south and southeast. And we see the poorer regions in green and yellow, the north and the northeast. We noticed an increase in mortality in children and adolescents in the same period.
otros análisis para comparar la sobrevivencia
The calculated or estimated survival
a estimativa através de
Thank you so much, Karina, for presenting these indicators to measure the impact of survival and quality indicators within these regional strategies. Dr. Vasquez presented this at the beginning. She said that we are compiling all of this information for the region to be able to present the country profiles later on, and other data on the progress of this initiative at the regional level. We will be receiving a lot of data within the members of the group. Thank you so much, Dr. Ribeiro. We have learned a lot about the cure-all package. So the next presentation will explain what does the package contain. Dr. Roberta Ortiz, I am proud to present her. She is a technical officer at WHO in Geneva for the Global Initiative. She is pediatric oncologist from Nicaragua, from our region. And she has done excellent work in the region, and now she's working at the world level. Dr. Ortiz, you have the floor. Thank you so much. Thank you, Anna. It is a real pleasure for me to be here. Good morning, everybody. Thank you to the excellent PAHO team that is leading this work to ensure that there's more access and better care and quality services for the control of childhood cancer. It is a very distinct honor for me to be here, and also for the technical team in Geneva to be able to share the results of our joint works, not only with WHO, but also with other cooperators, partners at the global level that are committed to the implementation and to the advancement of the global initiative against childhood cancer at the world level. In my presentation today, I will talk about the context that was already presented by Liliana in an excellent way. And we will go to the technical package, to the group of tools that we have for implementation, and some of the next steps that we have foreseen to support the countries in the development of their plans and policies for the control of childhood cancer. So we will be talking about the problem of childhood cancer. We know that cancer is one of the main causes of death of children and adolescents at the world level. And every year we diagnose approximately 400,000 children and adolescents with some type of cancer. We very well know, as Silvana has mentioned and Liliana has mentioned, that there is a profound inequality in health. 80% of these children live in countries with limited resources and inadequate access to health services and diagnostic services. And all of these factors gives us the results a very low survival as compared to those of other countries. And so in the past few decades, we have seen a rapid improvement in pediatric cancer in most high-income countries. In low and middle-income countries, we don't have the same situation. And that is because the lack of access to services and cancer control services are limited. So we have limited coverage, and that's because childhood cancer has not been included in cancer national programs. And many countries in the Central America and South American region is moving into that direction. A few countries include cancer in their benefit packages, and then the technical capacity for human resources is very limited and infrastructure is very limited. However, we do know that childhood cancer is curable, and it is curable with low investment, with low cost, with generic medicines and other ways of treatment, such as surgery and radiotherapy. So this is a good option to prioritize the public health agenda and to be able to transform health services to make sure that the countries are free from this early mortality and to be able to attain the sustainable development objectives set by the United Nations. We have seen that the global implementation against cancer in childhood has been possible by the participation of partners from different sectors, the government, academic centers, civil society, peer groups, survival groups, professional associations that have demonstrated that the inclusion of childhood cancer as a priority is effective and sustainable. So this has been possible thanks to the implementation of the approach that I will be developing now, Cure-All. We have several laws, we have governance, we have for countries like Peru and Philippines that have really established policies to help children. And also we have the effort of the regionals and regional networks to be able to exchange better practices, the adoption of coordinated measures at the national and regional levels. And this is harmonized with all the strategies and the national priorities. And we can see this in a tangible way here in PAHO in the region of the Americas. Also, given the large number of partners supplying technical support, we have been able to see the capabilities of the governments to fight against childhood cancer. And we are very grateful for the collaboration of St. Jude's Children's Hospital that from the beginning of the conceptualization of this initiative has helped us. And all of these efforts from the beginning of the launching of the initiative in 2018 have been clear. In May, during the 74th World Health Assembly, our Director General, Dr. Tedros, has recognized that childhood cancer is now a priority for WHO. It has the potential to transform the health agenda of the countries and demonstrate that small investments could result in big social and economic benefits. So we will be talking about the document itself, and I have been asked to present this document. This framework document, Cure-All, is a practical way of supporting the decision makers and the program administrators to control cancer in the formulation of health policy, targeting the increase of their capacity to give a coordinated approach and establish a coordinated approach. We from headquarters and Silvana's team are working together to support the partners and the committed collaborators, as well as the Ministries of Health, to increase their capacity to render and provide good health services. So the document, you will be accessing this document soon through the web. I will share the digital document with you. So here we have 3 sections. First of all, we have a multidisciplinary approach to consider children and their families. We have to target the socioeconomic needs of the family, and then essential competencies that are required by the interdisciplinary team that renders this care. The Cure-All is divided, framework is divided in 3 sections. The first one gives us a general background of childhood cancer, everything that we have talked about, the morbidity, burden, progresses in care, the causes of inequalities that have an influence in mortality by childhood cancer. And then the second session is the conceptualization of Cure-All, and he has 4 pillars and 3 facilitators. And that was already presented, and they contribute to improve the capability of the countries to render services that are quality services to children with cancer. And section 3 is a practical guide for the implementation of the Cure-All framework. And here we show the priority interventions that are necessary and that the countries must identify to improve the capabilities of their health services, to channel the proper care to children with cancer, and then it proposes a monitoring framework, and this is a joint work. Karina mentioned that we need to work on that from headquarters with the full support of the PAHO team, and then also through the regional partners and colleagues in other areas. For the implementation of the cure-all package, as Liliana has already mentioned at the beginning, we need 4 coordinated steps. The first one has to do with situational diagnosis. And here we had a question about the available tools for this diagnosis. And part of the technical part and of the technical package, we have an assessment tool, which is the evaluation tool. And it is has been developed with different agencies from the United Nations, the International Atomic Energy Agencies, and WHO and other agencies. And so through this, the countries can identify what is the situation of their health services to face the problems of cancer, and what are the actions that they should prioritize to be able to improve service access and quality. The second part has to do with planning, cost, and financing. And this next step is the result of national workshops or regional workshops. And we have seen that each one of the countries, we have had several focal points that have joined this pediatric cancer initiative. And we have already held regional workshops to identify not only the actors and the partners that can participate from different sectors, and several collaborators and non-governmental organizations, to be able to identify what are the priority actions that each country should undertake to implement this initiative. And the third part is the implementation by itself. And this implementation is attained through different government channels, professionals from health organizations, regional groups, support groups, support parents and patients, all the groups working in support of governmental efforts to be able to ensure quality for the patients. And then the last phase, as Karina and Liliana said, monitoring and modification. As Karina has already explained, all of this is linked to the technical package, because we have to prepare a set of indicators that we will be jointly developing in accordance with the needs of the programs in each country. And I mentioned that this is a work in progress and is being done simultaneously at the regional level with the cooperation of headquarters. One of the benefits of this framework is that through coordinated implementations of the 4 phases, we will be able to contribute to strengthening the health systems, because we can align the 4 pillars and the 3 indicators and the components, the basic components of the health systems, as you see here, will allow us to coordinate better provision of health services to children with cancer through the continuum of their disease, from diagnosis to treatment to palliative care. This represents the 10 priority projects or actions that were identified during the global and regional meetings and the national workshops. In these 10 projects, we have an alignment of the pillars of the initiatives, and the countries might identify, in accordance with their capabilities for care of children with cancer, what are the priority steps to start the implementation phase. All the partners in the initiative play a very important role to reach the initiatives to increase survival from childhood cancer, at least 60%, without forgetting about the reduction of suffering. Thanks to the work developed by the regional and sub-regional networks, we have been able to advance in the implementation of the Pediatric Cancer Initiative. In this last trimester or quarter of last year, in the second semester of this year, we have seen 13 new countries that have joined in the initial steps for implementation. And we have to congratulate the countries of the Americas because they are leaders in these programs, and this has been possible through the efforts of these regional and sub-regional networks that are contributing to the implementation and to the exchange of better practices and the adoption of coordinated measures in the countries and their regional priorities. Also, thanks to the increasing network of collaborators that provide technical support so that the countries can improve their capabilities to treat cancer. And now, very briefly, I will describe some of the main technical products that are available as part of the technical package and the toolkit for this. We have the Knowledge Action Portal. This is a virtual platform that contributes to strengthen the community and that controls the communities of cancer communities of practice. And then here we have policies, evidence-based policies, and then several alliances, and it has a platform that is being developed to present proposals for research and projects geared at increasing quality. We also have the tool of mapping with the partners. Here in the lower part of the screen, you will see, or you can identify which are the international organizations, the different academic groups that are willing to offer collaboration in their countries. And then right here, we can have alliances and partnerships to consider the implementation of this initiative. Thanks to this mapping function, we can identify possible partners, such as the International Atomic Energy Agency and also the International Association for Cancer Research. And they will help in the design, implementation, and monitor on national plans. So the work that they are leading in the region of the Americas also can benefit from the participation of all of these partners. Another part of the product that is being developed and that contributes to the implementation of these treatment regimes that are appropriate in accordance with the resources and the context of the country is also being reviewed. And we have a practice report for the Wilms tumor, which is one of the 6 types of cancers that are prioritized, just to show you that children's cancer is curable. So this document does not represent a practical way for the management, and it is not a protocol for treatment. This is targeting to those responsible for health policies, directors of cancer programs, and administrators.
And here we see the priority intervention throughout the continuum of the disease, from diagnosis up to the care offered to guarantee good quality services for cancer patients. And as we have already mentioned, for the situational analysis phase, we're about to complete the 3rd phase of the assessment tool that will be available for the Ministry of Health. And we only have the English version that is being improved on the online platform, which has also used the CEOP Global Mapping Survey. And as I mentioned before, this has been an instrument developed together with our colleagues from the Atomic Agency. based on the reviews or analysis, the impact review, whose goal is to determine the situation of the services for the cancer agenda, and also to provide recommendations as to how to use these resources to have better access and quality treatment for patients and children living with cancer. Currently, we are working this instrument that assesses the treatment of cancer nationally, as well as at the level of the institutions. And finally, I can tell you that as far as the countries are showing interest in joining the global initiative against pediatric cancer, we're also receiving many requests to support their efforts to develop national cancer plans. And through technical support with the tools that I have presented, the World Health Organization at the 3 levels, and also thanks to the collaboration with our sister agencies, with the Atomic Agency, we are working together to defeat cancer, and we are here available to help you with the monitoring design of these policies that need to be aligned with the needs within the countries, and also the needs within their own health systems, and also the goals defined within the ministries and the leadership. And I would like to conclude by thanking you. As Gabo showed us, pediatric cancer is highly curable, and by implementing this package together with the World Health Organization and the health authorities and all of the collaborators from the various sectors, professional, academic centers, groups of parents and survivors, we can work together to reduce the gap and reach the gap to save 1 million lives in the next decade. Thank you very much for this opportunity, and we are here to support you in the implementation of this initiative. Thank you. Thank you, Dr. Ortiz. Excellent presentation. Just to remind you that this cure-all package and all of the tools that you are developing globally will be used and implemented with our countries in the region, working also with the collaborators that we have in the region. And we also have plans to have national meetings with the stakeholders, starting with the Central American countries and then expanding them to the other countries that are participating in the initiative. So we will be implementing this as collaboration. We have heard about our collaboration with St. Jude. It is a pleasure to introduce our next presenter, Monica Metzger, who is a pediatric oncologist and national director for Central America and South America with St. Jude Global, and she will be talking about the collaboration with St. Jude Americas. Thank you very much, Silvana. Thank you for allowing me to participate in this webinar. Thank you, Gabo, for reminding us why we do what we do. And I would like to thank each of my colleagues that have presented ahead of me. Highly appreciated individuals, highly esteemed individuals who have shown all of the important data. I will try to discuss the history of our cooperation and our contribution. To start with, I would like to introduce our team. Amalia Valdez, Patricia Logetto, and Marta Harkin Pardo. In particular, Marta Harkin Pardo, I would like to underscore her participation since together with myself and PAHO, we are working in all of the global initiative in Central America and the other Latin American countries. And Patricia Logetto has been especially working in Brazil with us, but she's also interested in particular in the health units. We have heard about the initiative, rather cure-all package, and that's the reason why I am showing here again the idea of attaining at least 60% survival for pediatric cancer worldwide and reduce suffering and to save an additional million lives. Why is it important? It is important because since we started to work in 1962, our vision is for every child to have access to quality treatment. In the 90s and in early 2000s, we were working on the international outreach program to work in particular with our colleagues from Central America, but in particular with Brazil and Chile. And starting in 2016, we established Global Pediatric. This is when the World Health Organization appointed St. Jude as the first collaborator center with WHO for pediatric cancer in July 2018. This was launched to guarantee that kids have access to quality treatment. And as you know, we started with this World Initiative Against Pediatric Cancer and Cure All. To offer you some context, we need to know the mission and vision of health. And the vision is for every child diagnosed with cancer or a blood disease to have access to quality care. And the idea is to improve the survival rates through various tools, such as the exchange of knowledge, the implementation of new approaches to treatment, and also the creation of international networks committed with the eradication of childhood cancer. We go back to the cure-all framework and how are we going to increase the capabilities of the countries to offer quality services and also to prioritize childhood cancer worldwide? We do this through the 3 pillars, that is education, training of human resources needed for our vision, and also the development of programs and the creation of initiatives focused on patients, and finally, research by promoting research in pediatric oncology through research and also to maintain the continuing development. We support on St. Jude's departments, our cancer center, the graduate school, and all of this makes up the Global Pediatric Department and Global in St. Jude Global. Going back to Cure All, how do we focus our work? Our work is focused globally, regionally, and nationally. The collaboration framework, we work based on regions. For example, we have the set of countries with which we maintain the closest collaboration, but we also work on individual countries. For example, the continental Brazilian territory is an example, but we also work at the level of the medical institution, always placing the child with cancer and their family at the core of this strategy. We empower collaborators through strategic planning, through collaborative approaches. And here we have investigation, research, promotion of and mobilization of resources. And then we have the administration of the hospital and clearly the government institutions and WHO. Once again, we go to the 4 pillars. So excellence, centers of excellence, universal coverage, treatment, monitoring and evaluation, advocacy linked with financing. And this has led us to work in our first meeting, the first meeting when we brought not only these pediatricians, but also representatives with the Ministry of Health and Silvana. As you see here, this was in 2017, before we had pediatric cancer as an initiative. and the representatives of the ministry met their colleagues, the oncologists, and we knew that there were very important departments of oncology, and this was a very interesting project that also led us to have our support and training. And this is currently being also authorized, certified by this institution. And now we have our meeting of AHOPCA in 2018. We invited also representatives of the various federations, and we already heard from Marcela. Without these federations, the oncology units would not be working. Here in this workshop, we were able to strengthen the stakeholders and the main actors, and this is what we do. This was in AHOPCA 2019 in Costa Rica, whereby we also invited managers, and also one of the exercises that we had during this meeting was to underscore that all of the countries in Central America had the opportunity to work on this, on pediatric cancer. And a couple of months later in Costa Rica, we met to have a workshop, so that we said, let's meet together and see how we can put this together so that all of the countries can have this program in Central America. And I'm sorry I didn't mention Dominican Republic and Haiti, but they also help here. And Comisca met, and it was from Comisca that we launched the regional initiative for pediatric cancer, where we see different steps for various ministries that signed this based on the need for pediatric cancer in the region. And as you see, with the pandemic, this started in 2020, 2021. We have been working virtually. And how have we done this virtually? Well, first of all, we have had virtual strategic meetings between Comisca, St. Jude, and the Pan American Health Organization to determine how we can advance this strategy. And at the same time, the national working groups that had already been created over the last 2 years with the Ministry of Health, and also the local representative. We have also consultants that are being funded together with the various pediatric doctors. This is the group that is actually conducting the work in connection with the priorities to establish these national cancer plans. But it is important to underscore the synergies. For example, with St. Jude and Comisca, I think that this is the secret. This is the secret saying why things are working so well. And this is the reason why some of these countries have already launched their national plan, and they're going through different stages for validation and launch. And we are very proud to be able to work with them on this. As you know, Peru was the first country that was a part of this childhood initiative. And I think that there we also have a small contribution to make. We were the ones who launched the first national meeting on pediatric cancer. We also had various initiatives behind this effort. And now in December 2020, we had the second national meeting to see the progress made, and interesting enough, as part of the introspection, but also as part of the discussion during that meeting, we saw the need to develop a national plan or a national cancer plan. We have worked with Chile very closely, with PINDA, and with each of the institutions assessing this issue. We will continue to work together with Brazil. As I just mentioned before, we have several projects and a lot to do. And at this point in time, we are fine-tuning and also looking at the need to have Brazil as part of this global initiative against pediatric cancer. And we launched this in the workshop that we had together with SOBOPE early this year, whereby we analyzed the various health blocks, and we are very moved to continue to work with our colleagues in Brazil on this initiative. Well, very quickly, you have seen that these are the countries that we have been working the closest with, but I should also mention that we have other countries with which we are also working closely. With Ecuador, we have an agreement with the Ministry of Health, and also the interest to launch it as a global initiative against childhood cancer. Then we have also started our discussions with Paraguay, and in Guyana, we were also asked to help with this initiative. Now, without further ado, I would like to say that this collaboration is extremely important. It is encouraging, very exciting, and also to work hand in hand with PAHO, but in particular with Silvana and the three musketeers, as I call them, Dr. Liliana Vasquez, Dr. Fuentes Alavid, and Dr. Rivero. It's something that is very moving, and it is a great pleasure. All of this focusing on children with cancer. Thank you very much. I think that we have been able to make more progress in terms of time, and then give the floor to Dr. Marcela. Thank you, Monica. We treasure the alliance we have, the partnership we have with St. Jude Global, with your team. We haven't been able to make much. We wouldn't have been able to make so much progress hadn't it been for everything that we have had through you. Now, to conclude this webinar and also commemorating the Week of Cancer Survivors, the last presenter will be presenting on the development of a network of individuals who have survived pediatric cancer in Latin America. We have Dr. Marcela Subieta, who is the president of the foundation Our Children in Latin America and the Caribbean. I was saying that I would like to thank Silvana, everyone, PAHO, for the participation in this seminar. I would like to tell you that we are going to talk about what we see in Latin America, survivors, and also the beginning of the network, our strengths and weaknesses. You said it very nicely, and in the infographics, we saw already that 1 out of 3 cancer survivors will have a chronic condition when reaching adulthood, and this will require special treatment and also support with blood treatment. And some patients will have to undergo chemotherapy, radiotherapy, but all of these can be solved with proper and timely treatment. Now, as to the background and the policies and follow-up procedures for cancer patients, we see that there is a great variability, but only a few are seen by experts after their transition to adulthood. And if we look at the two studies conducted by OECD and our own foundation, we see that we have done a qualitative study in 3 countries, in El Salvador, Peru, and Mexico. And in our system, caregivers and parents are under the area of those that can actually participate and be part of this care. And the participation of parents in treatment may have a positive impact in the quality of life of the child, but also in the experience, treatment, adherence to treatment, and everything that comes afterwards, such as follow-up of survivors. This same group conducted a qualitative study in Latin America, where we see in these countries the lack of transition to follow-up processes, kids that have already had cancer also during their adult years. And those of you who are working in the area of pediatric cancer have a lot to do. So we all agree with this phrase that treatment is not enough, that survivors have or face great challenges in connection with the disease, such as being familiar with the background, the history of the information they had, the treatment received, the adverse reactions, and also how to prevent long-term effects or long-term conditions. In 2017, we translated these myths against the reality, and this was launched by the Cancer International Organization to call your attention to the survivors and to indicate that this is a disease that can be treated and cured. And in Latin America, for years, there have been several activities with survivors. I found some global gatherings in Ecuador, in Bolivia. We had some fashion shows and also some specific spaces for them to meet, to have some fun. They had some camp activities that were deeply valued by the participants. And I would like to show you the situation in Chile. That is the one that I know the most. And I would like to share with you that in order to call everyone's attention to pediatric cancer in 2008, as part of the cancer program, there was a gathering for life where we had 1,000 survivors meet. It was a very nice gathering. And after that, PINDA, that is the follow-up committee, published a study that was alarming because it indicated that the survivors do not have much knowledge of the short and middle term impact, and then we started focusing on positive behavioral changes that have to do with better nutrition, education, among others. In 2019, in the 11th meeting of CCI Latin America, we invited the doctor that had been in charge of follow-up to present the results of the Chilean study. And we committed, as a result of that presentation that all of the organizations that the organization in Latin America received, we committed to working in 2020 with survivors, and we invited them to the gathering in 2020. That was the last one we were able to convene in person. So we invited them to go to Peru. We paid for the tickets, and we received survivors from 6 countries. We also appointed an advisory group, and they had a working session that was of great interest. And from this meeting, we had the beginning of the network of survivors, and they worked in breakout rooms and parallel meetings, and they decided, first of all, to create the first network to offer support and guidance, and also a board of young individuals that had been cancer patients to promote linkage to the network. They also decided to implement strategies according to their needs, and for that they created a whole list of necessities or needs, and then they built a digital platform. They created their own directory with the participation of the various countries, and they also took advantage of the social media to be able to establish contact with other individuals. And what have these individuals done? First of all, they had short and middle term actions. They convened virtual meetings starting in March last year. And also with the LATAM organization, the first virtual meeting of survivors from Latin America was organized in June 2020. And we had a guest from the European network that is quite advanced, the network of survivors. We had a representative of the Capitante group from Spain. And they have already drafted a survey on needs, and we wanted for this survey to be properly assessed in the future. So our advisory team, the youth advisory team, worked with them, and this survey is about to be published. So here I have a picture of the first gathering and the meeting that took place. They were extremely happy to be able to have individuals from various countries and also to get inspired based on the European experience. And what did we learn? We learned that survivors have the potential to work in groups, for them to also work with the difficulties. Even in spite of the main difficulties, they can work in groups. They lack time. They also have several commitments at personal and professional level.
There was a lack of consensus, and there were, of course, lack of coincidence of personal interest and so forth. But we all think that these actions are important. You know that when it comes to adolescents, it is important to have person-to-person encounter. Because of the pandemic, we were unable to have that. So we have to use the media and the social networks. Also, we see some lack of institutional support to have physical space and systematized guidelines. Finally, what is the role of foundations and associations? Well, NGOs can help in the creation of groups of survivors by giving professional support, guide to establish objectives, activities, and give visibility before society. We have formed a group of professional support formed by Dr. Anna Becker, a pediatric oncologist, from Chile, a Colombian psychologist, Dr. Yolima Mendez, Alejandra Mendez from Chile, she is the mother of a survivor. And then Nuria Rosal from El Salvador, she's a medical anthropologist. In addition, she participates in several groups. So we committed to promote the creation or support to local survivors groups so that later on they can become part of the Faros de Vida, meaning Beacons of Life group. Before finishing, I would like to invite you to 2 meetings. One of them will be 20th of June. This is the meeting of the network Faros de Vida or Beacons of Life. And also we will be holding a webinar organized by the Childhood Cancer International and St. Jude. And that will be on Saturday, June 26th. And survivors from Latin America will be able to participate there. I would like to thank you for your invitation, and I am very, very happy to have participated, to have developed this topic here. And I hope that we can continue to work together in this topic that is so important, much more so in developing countries. Thank you so much. Excellent. Thank you so much, Dr. Subieta. The psychosocial and social support are very important. And we would like to congratulate all the foundations for having formed this net of survivors. Now it is time to finish. And even though I see there are lots of questions and people are really interested in continuing, the interpreters have to go into another meeting, and we would like to ask you to please send us your questions if you want to be a part of this initiative. Yes, please do. And we really would like to have members of Latin America and the Caribbean for this initiative. My sincere thanks to all the presenters, to all of you for having accompanied us, especially to the interpreters who work in the 3 languages, and then my PAHO team for organizing this session. And I hope that we have given you good information in the fight against childhood and adolescent cancer in Latin America and the Caribbean. Thank you so much and have a nice day. Thank you. Bye-bye. No, no, mira, no te afanes. Mira, tú no te afanes que yo tenía